So colorectal cancer is the cancer which arises from the last part of the intestine. So last 1.5 meter of intestine, we call it as a large intestine, जो बड़ी आंत कहते हैं. So any cancer which arises in this part of the intestine, we call it as a colorectal cancer. So though this was a disease of a Western population, but now because of change in lifestyle, dietary habits, change in sedentary lifestyle, so the incidence of colorectal cancer is increasing like an epidemic in India. Moreover, there are some genetic factors also which are playing a role, and these cancers are now being presented in a younger population also. The only thing the colorectal cancer, they are good in a term that if diagnosed early, we can actually cure colorectal cancer. So we should stress on going for screening for colorectal cancer. If you see the American Society Colorectal Surgeon guidelines, they recommend screening for colorectal cancer above the age of 45. So we usually advocate screening anybody more than 45 who have a high risk symptoms. So we call them a worrisome or a high risk symptom, which include like unexplained weight loss, unexplained anemia, any bleeding per rectum, recent change in bowel habit. So anybody with these symptoms, they should be screened, or patient who are in a high risk group. So we divide high risk group: patient who has a family history of colorectal cancer, patient who have a intestinal inflammatory conditions like ulcerative colitis, like Crohn's disease. So all those patients, or with a family history of any polyp, colorectal polyps, or a genetic history of FFV, there is some genetic association with colorectal cancer. So anybody with these kind of histories, they should be screened at an earlier stage. So anybody, number one is high risk features, the number two is those who are in a high risk group. Nobody knows the exact cause of the cancer, but yes, in our body, so lot of cells, they are destroyed daily, lot of cells, they are formed daily in our body. So if there is an uncontrolled growth of these cells, so that causes the formation of a tissue which we call as a cancer. So there are some genetic factors associated with colorectal cancer, but more things which we are more concerned is that this is a disease which is related to the diet what we eat. This is related to our lifestyle. So those are the things we can change and probably decrease the incidence of colorectal cancers. If you take high fiber diet, the high fiber diet, more of like there are some vitamins like vitamin A, vitamin C, they have been shown to decrease the incidence. We should avoid high fat dairy products, we should avoid refined things, starch. So these things should be less in our diet. The other thing is lifestyle. So there are studies which have shown that sedentary lifestyle increases the incidence of colorectal cancer. So actually the study has shown that if you do vigorous activity around 4 hours a week, that has been shown to prevent colorectal cancer. Other thing in lifestyle includes consumption of alcohol, which has been shown to increase the incidence, consumption of smoking, so and high BMI. Especially this has been shown to be more relevant in male patients. So obesity, alcohol, and these sedentary lifestyle. So these are some lifestyle changes which you can do to decrease the incidence of colorectal cancers.